Good morning, everyone. Today's topic of discussion is about radiation protection. So, I'll be covering under these headings: introduction, definition of radiation protection, protection for the operator, protection for the patient, protection for the environment, conclusion, and references. Moving on to the introduction. So, principle of radiation protection is to do those things that will minimize the exposure of patient and other personnel and still provide benefits for the patient from the use of diagnostic radiography. So, generally, this is calculated based on inverse square law, that is based on intensity. Intensity or quantity of the radiation decreases as the square of distance increases, and it also depends upon the material through which the X-ray is passed. So, use of ionizing radiation, whether for diagnosis or therapy, not only result in irradiation for the patient, at the same time there will be some degree of exposure to the radiologist workers in and around the X-ray department. So moving on to the definition, according to International Atomic Energy Agency, radiation protection is defined as the protection of people from the harmful effect of exposure to ionizing radiation and means for achieving this. There are three guiding principles in radiation protection. First one is principle of justification, second is principle of optimization, and third is the dose limitation. So principle of justification states that dentists should identify those situations where benefit to the patient when the diagnostic exposure is required. So only high referral criteria patient is advised for radiograph, and principle of optimization. So it is often referred to as principle of ALARA and ALARA is as low as reasonably achievable and ALARA is as low as diagnostically acceptable. So optimization radiation exposure, it is a balance between radiation exposure and image quality. That means with minimum radiation exposure and maximum or proper image quality X-ray film should be obtained. That is, image with proper contrast, density and sharpness should be obtained. And third one is dose limitation. So dose limits are set for occupational and public exposure. So this is done to ensure that no individuals are exposed to unacceptably higher doses. So moving on to the first one, that is protection for the operator. So there are two most important sources of X-rays to which operator is exposed. That is, first one is primary X-ray beam and second one is scattered radiations. So primary X-ray beam is the radiation originating from the focal spot, and scattered radiation that is coming from the object other than the patient, such as from the walls and the furniture where the primary X-ray beam is straight. So there are other sources of lesser importance. Those are leakage radiation or stray radiation. So leakage or stray radiation is a radiation from the X-ray tube housing, and scattered X-ray from the filters, and scattered radiation coming from the object other than the patient. So these are the main sources for the radiation for the operator. So this is a pictorial representation of each one: primary, scattered, and leakage radiation during X-ray exposure. So how do we protect against primary beam? So primary beam is a beam or the X-ray which is directly originating from the focal spot. So we have to take the effort so that the operator can leave the room or take a suitable position behind a barrier or wall during the exposure. So behind a barrier or which can be made up of suitable material. If there is no shield or barrier, operator can use a lead apron too. And the operating room should be designed or constructed in such a way that should meet minimum shielding requirement, and position distance rule should be followed, which states that operator should stand at least 6 feet away from the source at an angle of 90 to 135 degree with respect to direction of the central X-ray. And film should never be held by the operator. Ideally, we can use film coating devices for the stability. If for the pediatric patient, if it is not possible, a parent or those who are accompanying the child care are responsible for the patient, and they must hold the film in position. And avoid holding the X-ray tube head of the machine. The suspension arm should be adequately maintained, or uh, this is maintained to prevent the housing movement and drift. Next is protection against leakage radiation. Leakage, or other name is stray radiation, that is defined as a radiation emitted by any other part of the X-ray tube other than the focal spot. So for protection against leakage radiation, neither the tube housing nor the cone should be handheld during the exposure, and machine should be periodically checked for any leakage. Protection against secondary and scattered radiation. As we have already mentioned, secondary radiation is defined as a radiation emitted by a substance through which X-ray is passing, and scattered radiation is defined as a radiation that has undergone change in direction during the passage through a substance. So we can protect from this radiation by usage of high-speed films. So high-speed films such as E or F speed films can be used. The specialty of these films are they are having higher crystal size. So higher the crystal size, the lesser the time taken for the emulsion to react with X-ray photons. So we can use higher speed films and replace the short cone with an open-ended lead line cone. So X-rays are less divergent when we use open-ended lead lined cone, and we can adequately filter the primary beam. So when we use the filter, we can filter out the low energy photons. These low energy photons will add to the radiation dose. So we can use these filters to reduce the radiation dose. And use of collimator. So when we use a collimator, we can reduce the size and shape of the X-ray beam. So if we reduce the size and shape of the X-ray beam, the size or the volume of the tissue irradiated is also reduced. And for monitoring this accumulated dose, we can use personal radiation monitoring devices such as film badge, TLT badge, or pocket dosimeter. Second one, that is protection for the patient. So only high yield or refractive criteria patients are advised for radiograph, such that radiographic examination should provide information for the treatment and prognosis. Selection of image receptor is very important here. For that, we can use high-speed films. So when a decision is made that a radiographic examination is justified, the way in which examination is conducted also greatly influence the patient exposure to radiation. So faster films are desirable from the standpoint of exposure reduction. Second one is use of intensifying screens. Intensifying screens are used in extraoral radiography. So the material that can be used as intensifying screens are gadolinium, lanthanum, or calcium tungstate screens. So by using intensifying screens, we can reduce the radiation exposure. These screens are having the property of fluorescence. So when the X-ray photons strike this fluorescent material, there will be production of visible light. So visible light will in turn react with the X-ray film that is sandwiched between the intensifier screens, thereby reducing the radiation exposure. Next is source to skin distance. So X-rays are less divergent at longer distance. So when the source to skin distance is increased, the radiation dose can be reduced. Why? Because these X-ray beams are less divergent, and less divergent means less volume of the tissue is irradiated from the radiation. So longer focal spot facial distance result in 32% reduction in the exposed tissue volume. Next is collimation of the beam. So collimators helps to control the size and shape of the beam. So in intraoral machines there are fixed collimators, and in extraoral machines these are adjustable. So recommended beam size of this collimator is not more than 2 and 3 by 4 inch in diameter at the patient face when the source film distance is 18 centimeter or more. So there are two types, rectangular and circular one, and rectangular collimators decreases the radiation dose up to 5-fold. Next is by using filters. So the main function of filters is that they will filter out the low energy photons. These low energy photons are considered undesirable as they add to the patient dose unnecessary radiation exposure. So the material which is used as filter is aluminum, and the thickness depends upon the kVp. Next is by using leaded aprons and collars. So these lead aprons are considered secondary measure to protect the patient, and primary measures are by using the high-speed films, by using the collimation, by using the aluminum filtrations. So these are considered as a primary means of reducing the exposure to the patient, and lead aprons are considered as a secondary measure. Next is by reducing the kilovoltage. So the normal kVp range for intraoral machines are 50 to 100 kilovoltage peak. So when the kVp is reduced, the energy of the beam also decreases. So when the energy is reduced, the a beam with more low energy photons. So this characteristic features of these low energy photons is that they carry the potential for the risk, and at the same time they are not useful in making an image. Next is by using film holding devices. So this offer stability to the X-ray film and also protection to the patient by reducing the frequency of retakes, and this also provided an external guide to indicate the film position and the possibility of misaligning the X-ray tube, and the concut can be reduced by using film holding devices. Third one is protection of the environment. So the surrounding environment must be protected from the radiation to avoid exposure to the persons in the environment. And this can be done by uh, primary beam. Primary beam is a beam originating from the directly from the X-ray tube head. So it should never be directed at anyone other than the patient. And patient should be positioned such that X-ray beam is aimed at the wall of the room and not through a door or any other opening where the people may be located. And the wall should be made up of 2 inch of the concrete or 3 inch to 16 inch of the steel. And if lead is not there, if the lead is not there, alternative material is barium, and barium is selected due to its high atomic number, high density, and its high linear coefficient of attenuation. It is necessary for the operator to see the patient as he is being irradiated. So a window is provided, and window should be situated such that primary beam is not directed on it. So lead glass is used here. 7 mm of lead is used. It is used as a secondary barrier, and doors of the radiology room. This also functions as a secondary barrier. So for this, 12 mm of lead is incorporated. Okay, finally, the conclusion of radiation protection. So, radiation is a double-edged sword which helps not only in diagnosis and therapy but also causes side effects on the other side. So, monitoring of the radiation to the personnel can be accomplished by eliminating the harmful effect of radiation. So, this regular monitoring can be done by using monitoring devices that will definitely help in reducing the burden of radiation, thus helping the mankind. So these are the references I have taken for this topic. So these are taken from White and Furrow, textbook of oral radiology, Frenier Karchodkar and Eric Weiss. Thank you everyone and happy reading.